You're welcome back to the AM Club right here on MX24. If you're just joining in, you made the right choice. You're coming to the best morning show in the capital. My name is Miriam Udwaka-Mensah, and of course, this is the Lifestyle Daily segment of the show. We're about to have a very important conversation. I think somewhere last year, we continuously said on the show that we didn't quite like Thursdays because it gives us a reason to want to do the right thing with our health. But it's an important time of the years of the week as well to have conversations pertaining to our health. And so please welcome back to that part of the show where we scare you a little bit but keep you on your toes a little bit as well with regards to your health. Now let's get into some other conversations before we get into the big conversation for this morning. At Equity Health Insurance, the well-being of our members takes precedence. We recognize the unique healthcare needs of individuals and families, which is why we are delighted to present our Ebusia Health Plan. This health plan is crafted to promote the enduring health and happiness of you and your loved ones. Of course, our plans are meticulously tailored to offer comprehensive and competitive health insurance coverage for individuals, families, and smaller groups. Access to quality care is just a phone call away, offering continual assurance of your family's welfare. Contact us today on 0546 645 465 or 050 3860 381. Equity Health Insurance, we always say, we're always here for you. Are you passionate about interior design but don't know where to start? Or maybe you're an aspiring designer looking to elevate your skills? Look no further. Introducing Design Lab by Salom Dream Maker, powered by Accento Project. Our comprehensive training and coaching courses are designed to solve the biggest challenges faced by both budding interior designers and construction teams. From mastering the latest design trends to understanding clients' needs and project management, we've got you covered. Whether you're a complete beginner or looking to refine your skills, our courses offer something for everyone. Learn from industry experts, gain hands-on experience, and join a community of like-minded creatives. Register to reserve a slot for our January sessions, which is this month, and transform your passion into a thriving career. Our students have gone on to create stunning spaces and successful businesses. Ready to take on the next step? Well, contact us today on 020-888-2722. That's 020-888-2722. Or visit our office at Ajirengano, that's right here in East Legon. Design Lab, where design dreams come to life. Even more this morning, shopping just got close, get a bit more easier, getting closer to getting to a very easy shopping experience. It got better and smarter. A to Z Department Store, your trusted go-to shopping destination in Ghana, is now live online. We are live online. Experience the same trusted in-store excellence from the comfort of your home. From fashion to lifestyle essentials, we've redefined shopping to suit your lifestyle. Simply visit www.onlinestore.azgroupgh.com. Browse, click, and enjoy seamless shopping anytime, anywhere. So please just jump onto the website, that is www.onlinestore.azgroupgh.com. A to Z Department Store, where style meets convenience. Style definitely redefined, and that is what A to Z is giving to us. Well, done selling. Let's get into the big conversation for this morning. Today we are having a conversation on cervical cancer, and joining us for the conversation is Dr. Esther Y.A. Eya, the medic.
Dr. Esther Yesuto Agbozo. So Eya is just Esther Yesuto Agbozo.
Okay.
Yes, the medic because I'm a medical doctor.
Of course. Good morning, good morning.
Good morning.
She is, of course, a medical doctor, and she's about to take us into the biggest conversation for this month of January. And if you do not know this, I know it's not as popular as other conditions that we highlight during the year, but cervical cancer month is January, and we try to use this month to loud enough the conversation on cervical cancer. For you females watching this morning online and on air, it is an important conversation, so please stay with me, okay? Cervical cancer has gone on to kill more women around the world than many cancers, and it has become important to have this conversation this month. So let's get into it. Since we all are going to play oblivious this morning, or we do not know, or ignorance of the conversation this morning, I say that carefully and respectfully. I'm going to ask you this morning, but before we get into that, how are you doing?
I'm very fine, thank you. How are you doing? Many happy returns.
You look stunning.
Oh, thank you.
Thank
you look
you so
beautiful
much,
as well.
Thank you so much. Thank you so much. Now let's get into the conversation. Cervical cancer. What is cervical cancer?
Okay, so cervical cancer is simply cancer of the cervix.
Okay.
Right now, somebody will ask what the cervix is.
Yeah.
So when you take the females, our reproductive organ, we have our womb, right? Then we have the cervix, and then we have the vagina. So the cervix is a connection between the womb and the vagina.
Right.
Right. So now when you have cancer of the cervix, that is cervical cancer. Now somebody's even wondering, what is cancer at all? Cancer is just an abnormal growth of cells. So God in his own wisdom has programmed our cells to divide at particular point in time, and some cells have to die at particular point in time. However, when there is any change in the DNA of the cell, some of the cells will refuse to die when they're supposed to die, and some of them will multiply more than they are supposed to. So now we have an excess of cells. Right, this excess of cells now becomes an abnormal, it can become like a mass. And then this mass will now begin to invade on the surrounding tissue, can move to other organs in the body and cause problems. That is basically cancer. Right. So when we say cervical cancer, we're talking about cancer of the cervix, which is the connection between the womb and the vagina.
I have heard this quite a lot, that we are not sure what causes cancers. Is this the same, is this the case for cervical cancer as well?
No.
Okay.
For cervical cancer, luckily, we know the main cause of cervical cancer, which is a human papillomavirus, right? So this is a virus that is sexually acquired. Now, this virus, it has been shown that about 70% of cervical cancer cases are caused by the human papillomavirus. And so if you get this virus, the unfortunate thing is that most people can get this virus and go on for years without any symptoms, and they will not know. The very first symptom they will get will be the cervical cancer diagnosis, right? And so people with the human papillomavirus are at risk of getting cervical cancer. However, there are some other risk factors that we can talk about. So we are looking at people who smoke. Now, it has been shown that all sexually active people, almost all sexually active people, would have the HPV virus infection at some point in their lives. So once you're sexually active, at some point you would get the virus. However, our body is able to fight the virus to a good extent. So most people will be able to eradicate the virus from their system. But there are a few people who will not be able to do that, and they are the people who may end up with cervical cancer, right? And so when you take the other risk factors, we are looking at smoking. It has been shown that people who smoke, for some reason, when the virus gets into their system is not able to eradicate the virus.
That's women who smoke?
Yes. Even men. Now, we say cervical cancer and we think it's a women's problem. To surprise you, the human papillomavirus can affect men and cause cancers in men.
In different type of cancer?
Cancers, yes.
Men.
Penile cancer, throat cancer, just that they don't have a cervix. So it's not like they are spared automatically.
Yeah.
Because if your partner has the HPV and you're a man and you get it, you can get other forms of cancers. Right. So you are not entirely spared as men.
Absolutely.
Right.
Absolutely.
Yes. So it has been shown that people who have, who smoke, they can't get rid of the virus from their system for whatever reason. It has also been shown that people who use a lot of oral contraceptives are at more risk of getting cervical cancer. The reason is that these contraceptives have hormones, right? And these hormones have the ability to change the morphology or the structure of the cervix, right? Which makes it easier for it to become cancerous, right? And it has also been shown that women who have had multiple children, right? So again, having too many babies becomes a risk factor. The unfortunate thing is that having too many babies is protective for some health conditions, and then it becomes a risk for other health conditions.
What health conditions is it protective of?
Yeah, so when you take something like endometrial cancers, the ovarian cancers, having more babies sort of reduces your risk.
Oh, yeah.
And then now it increases your risk for cervical cancer, so you can try just to stay in the middle.
No.
Yes.
Women.
Yes.
But still, you would think that we're entitled? Really?
Yes.
Anyway, let's get into... if there are some genetical factors that contribute to getting cervical cancer, could you get cancer just because someone in your family had cervical cancer?
So you see, when we talk about cancers, because we are talking about DNA change, it is possible. However, when you take cervical cancer, for instance, we don't attribute a lot to genetics. It is possible. Even data has shown that back in the day, women who were trying to avoid miscarriages, when they are pregnant, they are giving a particular medication, right? Now, this medication, just because your mother was exposed during your pregnancy, can predispose you, the child, if you're a female, to having cervical cancer years down the line. So there's a little genetic factor, but it is not so much for us to, pin it on genetics.
Yeah.
The main culprit when it comes to cervical cancer is the HPV virus. Yes.
Right. Now, let's get into, before I come here and tell you that, oh, I have cervical cancer, or I could be prone, or I look like I have cervical cancer. What are the symptoms I'm supposed to be looking out for in my body to recognize that this could be cervical cancer?
Right. So like I said, majority of women will go on for years with no symptoms.
Yeah.
So when you get the virus, you can go for 15 to 20 years, no symptoms at all. For people who would eventually get symptoms, some of the symptoms they would see would be pain. So pain, we're talking about pelvic pain, which is we would describe as lower abdominal pain, right? So this pain can be during sexual intercourse. It can be during their menses, such that it is more severe than the cramps that they usually have, right? Some women will begin to have abnormal uterine bleeding or abnormal vaginal bleeding, simply put, right? This bleeding can be outside of their menstrual period. So it is not time to have their menses, but they are bleeding. Maybe they are postmenopausal women, they are not supposed to be bleeding anymore, but they are bleeding. Maybe it is time for their menses. They are bleeding more than they would usually bleed, and then the period is extended. The number of days is also extended, right? So we can look at abnormal bleeding as well. And then when we take all cancers, there are some symptoms that are peculiar to all cancers. One of them, classic, weight loss. So somebody is having unintentional weight loss. They don't plan to lose weight. They are eating, but they are losing weight. Some people will have fatigue, and any little thing they do, they are tired. The reason is that cancer cells tend to attack other organs in the body, like your liver, like your lungs, like your kidneys, right? And so at the end of the day, these organs help you to stay strong and all that. So when they are being attacked, automatically you begin to feel weak, you have fatigue, some people have night sweats, some people have fevers and all that, right? And then again, for cervical cancer, some women will have vaginal discharge. This vaginal discharge, it may be bloody, it may be clear, right? And it will have a foul or offensive odor. Right? And the thing is that because some other sexually transmitted infections have the same or similar symptoms, you can say automatically that it's cervical cancer. But once you're sexually active, right, especially if you've had multiple sexual partners, all your sexual partners have had multiple sexual partners,
that
right?
one.
Then it means that you're at risk. So when you come, we would, of course, do the screening for the other sexually transmitted infections or all the other vaginal infections you can have. And we will throw in the cervical cancer screening just to be sure that that is not what it is, especially depending on your age. If you are over 30, 35, then we are looking at getting you screened for cervical cancer.
Right. Yeah. Now, let's backtrack a little bit to this conversation being introduced to the Ghanaian woman. When breast cancer was introduced, for a very long time, people were demoralizing the conversation and also making it look like it was demonic as well. Until, I don't know who made it happen, but WHO might have helped. Lots of bodies that saw the conversation as a very important one, pushed it to a point where we had survivors coming out, setting up foundations. Now it's a big thing that in October, no organization can lose sight of campaigning for you to be screened and what have you. But it also looks like gradually we're moving towards the conversation of cervical cancer, but it's not as loud. How do you think Ghanaians have embraced this conversation, and what do you think we are as, from a medical person's perspective, how are we approaching the conversation now as a Ghanaian woman? Yes,
I think that people are getting more enlightened, but you rightly said, a lot of people are actually ignorant about cervical cancer, right? So even when they come to the hospital and you're telling them that it could be this, they begin to think about all the spiritual things. Most people want to go and pray first, even before they come and do the test and all the treatment that they could possibly explore, right? So we are getting there, but we are not there yet. The reason also is that because this is a more of a sexual conversation,
Yes.
because it's HPV, which is sexually transmitted.
Yes.
So for somebody to get it, it means there was sex involved.
Yes.
And the Ghanaian people are not, so okay with discussing sex for whatever reason.
But they have sex.
Of course. That's how we all got here in the first place. Right. And so because of the sex aspects that are attached to this conversation, a lot of people are uncomfortable talking about it. But I think that if we continue to make noise like we did with breast cancer, eventually we will get to a point where people will become comfortable accepting that this is a conversation we should have.
Now, when it comes to that as well, it's also a screening conversation.
Yeah.
At what age should you start screening for cervical cancer?
Right. So the WHO will tell you that usually you expect to start screening after 30, right? The reason being that by then your risk is a little higher. However, other literature also suggests that you can start as early as 21. Once you know that you've been sexually active, because one of the risk factors is early coitus, which is early sex. If you had sex at an early age, you should start screening around 21. Now, when you start around 21, between 21 to 29 years, you should repeat the screening every 3 years. So every 3 years, you do the test. We call it the pap smear, right?
Yeah.
So you do the pap smear every 3 years. But once you hit 30 upwards, we expect you to do what we call co-testing, where you are doing the pap smear plus testing for the HPV virus, right? Because the pap smear only tries to look at your cervix to see if there are any abnormal cells.
Yeah.
But then the co-testing, we'll do the pap smear, then we screen you for the HPV virus as well. And then the good news is if you don't have the HPV virus, we can go on to vaccinate you to protect you from, even if you do get exposed to the virus, your risk of getting the cancer becomes almost zero.
Right. I was going to go into that. Like, how do we prevent it totally? So one of it is getting the vaccination for the virus.
Yes.
How available is the vaccine in Ghana?
The vaccine is available in Ghana.
And how much is it?
The truth of the matter is that depending on where you go, right?
So it's not free?
No, it's not free. Even the screening for cervical cancer is not free. We are not there yet.
Oh.
Yes, because the pap smear, I think just 2 days ago, I was having a conversation with a lab friend, and he said it's around 200 to 300
Yeah, I do the
teeth.
pap smear, I think, twice a year for some strange reason.
Oh, you don't have to do it twice a year.
I know, and that's what my doctor keeps saying. Maybe you don't have to.
You don't have to do it twice a year.
Well, I don't know. I just like to be extra
Safe.
sometimes.
Yeah.
But also, again, the other things the pap smear, achieves also there.
Yeah,
So you want to do it. It's better done twice than none.
True.
Okay, so please allow me. But yeah, there is that.
Yes.
For the
screening
HPV.
is not free. The vaccine is not
free, but it's worth it.
Yes, it's worth it, and I think it's cost effective. It's not too expensive.
Absolutely.
But then again, a lot of people may not be able to afford it. So
Yeah.
that is why we need to have a lot of campaigns where organizations will be interested in
support for it.
sponsoring free cervical cancer screening,
Yeah.
free vaccination. It would go a long way.
Absolutely.
Yeah.
So again, does the vaccination have an age range where you can get it? Or?
Yes. So the WHO recommends that we vaccinate people before they become sexually active. So usually the target age is 9 to 14.
Wow.
Before they become sexually, we are hoping that they become sexually
by that
active.
time they are not.
But of course, we see a lot of
And
outliers.
there's also the bit where children are usually abused before they get to that age.
Yes.
And so unwillingly they've been introduced to a space where they are not ready for.
Yes. But the WHO recommends that between 9 to 14 years, you should get vaccinated. But if you are beyond that age, it's not too late. You just have to screen for the HPV virus. If you don't have the virus, you can get the vaccine.
Okay.
But if you do have the virus, then it means that, unfortunately, there's no cure for the virus, right?
Is it?
Yes.
What?
Yes. So there's no medication that we can give you to eradicate the virus.
So
it's
it comes into your body and it stays there?
Your body can get rid of the virus.
On its own?
Majority of people, their bodies get rid of the virus.
Right.
But there are select few that the virus, for some reason, stays in their body.
Let's stay on the body getting rid of the virus by itself. What kind of immune system can get rid of the virus on its own? And what do you have to do to be able to do that kind of, for your body to be able to take part in that kind of exercise?
You just have to have a healthy immune system.
Right.
People who don't have a healthy immune system are people who have diabetes, people who have HIV, people who have any form of cancer and they are undergoing chemo or radiation therapy. Because these things have been shown to suppress your immune system. So if you don't have any of these things, technically you should be able to get rid of the virus. However, again, there are some questions that even we medical professionals can't answer. For some reason, some people will not have any of these conditions, but the virus will still stay in their body. But most of the time, the people who end up with the virus are people who have some other conditions. So the diabetes, the hypertensions, the HIVs, because data has been shown that people with HIV have a 6 times more risk of getting the cervical cancer.
Yes, because their immune systems are damaged.
It's damaged. It can't fight the virus at all.
At all.
Right. So to have a healthy immune system, it's just the basics that we talk all the time. Exercise, good diet, sleeping well, managing stress. It's just the basics. Nothing special.
Nothing special.
Yes.
So this year, as we're talking on cervical cancer, we've also learned this morning that HPV virus, when it gets into your body, can be, attacked by your immune system if you have a good immune system. So like she said, one thing that we're campaigning this year is healthy living. You've done all these years of your life doing all the things you're not supposed to do, had lived your life, soft life, hard life, all the lives you've done. Now it's time to take care of yourself. A healthy life is the new cool, okay? So eat well, more fruits, more vegetables, so that your sexually active life will not destroy you. Because again, we're learning this morning that once you have a good immune system or a strong enough immune system, you're able to fight this virus so that you're not too prone or too vulnerable for the cervical cancer too. Now let's go back to our conversation, cervical cancer. Now you have the cancer in your body. It's been discovered late or early. Early stages of cervical cancer, what are you able to do?
So if it's discovered, we have stages. So we have from stage 1 to stage 4.
Wow.
So when we discover cervical cancer, maybe at stage 1, where it is confined to just the cervix, so it has not spread anywhere. It's just the cervix, right? We have a lot of options. Most of them are surgical options. So your surgical options are, we can go and just take out the part of the cervix which is affected, right? Then we can follow it up with either chemotherapy or radiation therapy. Our other option is we can go and take out the entire womb, because the cervix is connected to the womb. So if you are done having babies, you have no business having babies again. You don't need your womb for anything. We could go and take out the entire womb. Case closed, because there's no more cervix, there's no more cervical cancer, right? And then for some people, we can do what we call ablation therapy, where we are using heat to damage the cancer cells, right? We can also do cryotherapy, where we are trying to freeze the cancer cells to kill them, right? So there are options like that. Now, for women who have maybe stage 2 means that now it's gone a little beyond the cervix. So it is spreading to the other organs. So the womb itself is there, on the sides, the pelvic wall is there and all that. Once it begins to get into the pelvic wall, again, we can do the surgery, take out the cervix, and follow up with chemoradiation therapy. But it may not be as effective as stage 1. Right? Then by stage 3, it is compressing on the other organs like the ureter. The ureter is the connection between your kidney and your bladder, where your urine comes out from. Right? So now once it begins to compress on the ureter, some people even end up with kidney failure, because now the urine cannot descend as it should, because there's something, blocking it. Right? And so for those people, again, sometimes we may do surgery just to relieve the pressure on the surrounding organs, but it may not do much because the cancer is already spreading. Then stage 4, where we don't want anybody to get to, is where it has moved to other parts of the body. So the lungs, the bone. Cancers, for some reason, like the lungs, they like bone, they like the liver. So once it gets to these major organs, you end up with maybe lung failure, liver failure. Some people will end up with kidney failure. That is what actually kills most of our cancer patients. It is not the cancer itself. It is the effect it has on the other major organs in the body. Right? So once it gets to your lungs, your liver, your bones, some people will come with back pain, some people will come looking jaundiced and all that, then we know that.
Tell me what we have on the screens right there, right now. If you can project it on the bigger one for me, I'll be grateful. Tell us what it looks like right now on the screens.
Yes, so you see the very first image is telling us the normal cervix, right? So like I said, the cervix is the connection between the vagina and the uterus or the womb.
Yes.
Right, so that is what the normal cervix looks like. Then when you take the next image after the normal one, that is the stage. So you come to know that even the stages, when we take stage 1, we have stage 1A, we have stage 1B, stage 1A, we have A1, A2, so it's a lot, right? But not to confuse our viewers, you see that when you take the second picture, that is stage 1B, where the cancer, it is still confined to just the cervix, right? So you see the cancer is just in the cervix. The stage 1B, it looks more advanced than stage the other one, right?
Yeah.
That's the late stage 1B. Then when you get to stage 2, you see that now it is entering other of the tissues outside of the cervix.
Getting out of the cervix.
Yes, now it's moving out of the cervix. So by the time we get to stage 4, it is moved to other parts of the body. Right. So that is just what this image is trying to tell us. Showing us the stages, what the normal looks like, what the cancer cells look like, and then how it progresses.
When we were saying in 2024 we didn't quite like Thursdays, we didn't mean it in a bad way, but we don't really like it because as a woman this morning already my abdomen is shaking because this is what could potentially just take away your life without knowing.
Yes, it has been shown that a lot of women who die young, a good number is cervical cancer. Because, you know, data tells us that there are 600 new diagnoses every year, and half of those people die the same year. So if we diagnose, I said 600,000. So if we diagnose 600,000 people with cervical cancer this year, half of them are going to die. That's 300,000 women.
Just dying of cervical cancer.
Yeah.
The only prevention for this is...
So there isn't just one prevention.
Okay.
So the prevention is the HPV vaccine, right? And then again, even if you do have the virus, regular screening, right? Because once you're screening for the cervical cancer, we can pick up signs that are suggestive and then we treat early. The other thing is we preach ABC. When we're young, they tell us that when it comes to sex, ABC works for us. So A is abstinence.
Yeah.
Your best solution is abstain. Because if you are not having sex, you have no business with HPV.
Absolutely.
Yes. If you are going to have sex, then you have to be faithful to your partner. Your partner has to be faithful to you. So we preach mutual monogamy, where both partners have just one partner. So it's just the two of you. So nothing is coming from anywhere else.
No extra members.
Yes. Because if you are faithful, your partner has other partners.
Please.
They will still bring it to you at the end of the day, right? And then the C is condom use. So you can use the condoms to protect you from getting the virus in the first place, just like all the other STIs, right? And then again, like we said, those who smoke, they need to quit smoking because it has been shown that if you smoke HPV, your body cannot get rid of the HPV virus. Women who abuse contraceptives, it's very important that you put a stop to it, right? Those who like taking 2 or 3 after pills in a week, if you think that you want, do a better family planning method, it's better than abusing the pills. Because again, it predisposes to things like this. And to our young girls, we encourage them to delay coitus or the first time they have sex. Because early coitus is a risk factor. So if you're having sex at a later age, the chances of you getting the virus reduces. And even the time of even if you do get the virus, if it becomes cervical cancer, you would have been older before it happens. Yeah.
When we were told when we were told to abstain from sex before marriage, it was once a very spiritual conversation, and people thought, oh, what do you think? You didn't have sex early. Some people were even mocked. I remember very well, a very good friend of mine, she actually had sex because she was being mocked because she hadn't had sex yet, and it made her look colloquial or whatever you guys want to call it. But now we've seen the benefits of abstaining and waiting. It goes way beyond the spiritual. It's a very medically related conversation. Once you abstain, you don't have to worry about all of these things. I mean, look at it, cervical cancer. What support systems are available for women who have had to find themselves in this condition, cervical cancer? What support system do they have in Ghana as it stands?
So as it stands, most of the family planning units in Ghana, so hospitals, especially the big hospitals, so the likes of Rich, Kolebu, 37, Confanoche, and even the district hospitals with family planning units, all of them have units where they take care of these women. So depending on the age at which you are diagnosed, if surgery can be done for you, be counseled appropriately, and then surgery can be done. If it has to be followed up with chemo and radiation, there are systems in place for that. If it's unfortunate that it's already spread, so we can do much for you, we have what we call the palliative care team. A lot of hospitals have a palliative care team who handle people with cancers at the advanced stage. So these people help you to make your life as comfortable as it can be before your passing. Because we know that once you're at stage 4, you are approaching the end, right? So we try to make your life as comfortable as it can be. So if you have pain, we give you pain medication. If you can eat, we give you infusions. If you have some infection, we treat with antibiotics. We try to make it as comfortable as you can be. And then, of course, the psychologist also comes in to, counsel them, because we know that it can be very, very draining mentally for somebody to be told they have a cancer, they have a year or less, to die and all that. So it's very important that we always try to do the multidisciplinary approach. However, I think that there is more that we can do as a country, because even though we say these systems are in place, there are some patients who still go on and not get the actual support that they need. And again, even the support systems, apart from the healthcare providers, even our families and our friends, it's very important that people know about these things. If you have a relative with cancer, that is not the time to abuse them, So that's not the time to blame them. It's already happened. So blaming them that you did A and that's why you have this, it was not going to change anything. Just try to be as mentally supportive as you can be. Help them as much as you can help them, because, in the next few years, they are not going to be here anymore. You want to look back on good memories and not bad ones. Yeah.
Finally, as we wrap up this conversation, awareness on cervical cancer, at least as we've started this year, what would you advise, in fact, for all of us who are interested in this conversation, women, how do we promote this conversation for people to, be aware of this cancer and take the appropriate measures?
Great. I think that most institutions should make this a priority. Because I remember last year, as of October, I was doing a lot of running around teaching women about breast cancer. And I think that if a lot of corporate institutions should do the same, it would go a long way. Personally, I have very recently, we started a medical consult where we can go around and teach and then do the screening for you. So if you're a corporate body and you think that you want to have your women together, you want us to educate them on cervical cancer, we are going to show up. If you want us to screen them, we are going to show up and do that for you, right? And so I think that a lot of institutions should focus on trying to help their women, putting them together, getting healthcare providers to educate them, and then go ahead and do the screening for them. Because the truth of the matter is, after this conversation, if you say everybody should go and screen, I can assure you the majority of people will forget about it after this conversation. Right. But if you bring it to them, of course, it's been brought to them, so they would be encouraged to do it. So I'd encourage corporate bodies, the churches, the schools, they should reach out to healthcare providers. We are available. If they want us to come and educate, we'll be there to educate. If they want us to do the screening as well, we'll be there to screen. Personally, ER Medical Consults, we are doing that. Okay. And so anybody who wants to reach out to us, they can reach out to us. Maybe they can send us a WhatsApp on 0549 823328.
If we want to hear more from your very intelligent self, how do we connect with you?
Yes. Again, because of... I am the face of ER Medical Consults anyway. Okay. So once you reach out to the number, you'll be able to get in touch with me. Right. So 0549 823328. ER Medical Consult. You can find us on social media as well. Or myself, ER the Medic. You can send me a DM on Instagram. I'll respond.
Thank you so much for coming through. We truly appreciate you, Esther. This morning has been very intense. What colors are we using for the cervical cancer?
Cervical cancer, these are the colors I usually see around. Yes.
And white. Yes, so I mean, look at it. Look at it.
You came prepared.
Because I have been very... Fact, my very good friend, she lives in Sweden. She has cervical cancer now.
Oh,
and so I am very... This conversation is personal to me. I know how we struggle through traveling around trying to get it sorted out. Yeah. And so I know it's a very devastating disease. But also, like she said, we can always totally turn this entire thing around and make it a better conversation for every woman to be more aware of cervical cancer. So this month on MX24, right here on the AM Club, we are going to make sure to do our very best. Thank you so much, Esther, for coming through.
Thank you for having me.
Now, right here as well, we're doing this for God and country, but stay with us and let's promote this conversation on cervical cancer. My name is Miriam Uduak-Mensah. This has been the most craziest, lifestyle daily. We started again, but listen, we're going to survive Thursdays on the AM Club. But let's move on to some plug. Let's get a little lighter conversations right here on the show. Don't move. Stay right here with us.